My name's Gabby,
My name's Gina.
I'm Izzy.
and today we're talking about tinea, more commonly known as ringworm.
Okay, so to begin, we're going to talk about the causative agent. So the scientific name for ringworm is Tinea dermatophytosis. It's caused by a dermatophyte fungi. It is a common infection of the skin, nails, and hair. When it's on the skin, it can look like a circular red rash. It tends to be itchy, and when it's found on other places of the body, such as the feet, it's called Tinea pedis. In the groin area, it's called Tinea cruris. For the body, it's called Tinea corporis. And then for the scalp, it's called Tinea capitis.
Transmission of tinea ringworm spreads really easily because it's a dermatophyte fungi that survives on the skin and objects for long periods of time. It is transmitted directly through skin-to-skin contact with infected person and animals. Some stuff that could cause this infections are usually towels, clothing, gym equipment, hairbrushes. Animal to human transmission very common from cats, dogs, kettles, and horses, and animals like that. Environmental transmission, fungi survives on surface for a very long time, such as days or even weeks. Epidemiology, who gets it most often? This usually happens through children, especially in daycares and schools, athletes, especially wrestlers and swimmers, gym members, people who are frequently always physical contact, such as shaking hands, hugs. Common locations for these outbreaks are gyms and locker rooms, daycares, farms, animal shelters. Households with infected pets are a very common one also.
All right, we're going to talk about the pathogenesis, or the path ringworm takes to get from outside the body to your body. So we're going to begin with dermatophytocytes, which basically break down keratin. Keratin is a colorizer in your skin, and the organism, after the keratin breaks down, is able to adhere or stick to your skin. And then while the enzymes break down the tissue, it's able to spread and then release an enzyme called keratinase. And all this goes to result in a ring-shaped rash with discoloration. We can see in the symptoms, and this picture shown here, where you're able to see the ring-shaped rash and the discoloration over here. Other symptoms you'll see, it usually is itchy, but you don't want to scratch it because that will release the fluids. It's common in buttocks, trunk, arms, and legs. The trunk, arm, and legs is because those are usually the areas of your body where you come in contact with other people. And for wrestlers, obviously, the sweat mixed with the skin is easy to spread tinea. You'll see color changes. The most common colors found are purple and red. The purple is caused by the overlap of the keratinase and of the organism on itself, resulting in a darker color than just the red, and it will tend to expand the more you itch it.
Okay, so for diagnosis, tinea is usually very noticeable based on its circular rash and the redness. So usually it's just diagnosed through a physical exam or just like an eye exam, but well, not like eyes, but by seeing it. But it is usually diagnosed just by the eye, or the doctor can scrape the skin and observe the cells under a microscope. Under the microscope, this is what the tinea fungi looks like. So if the doctor sees this or whoever is researching it sees this under the microscope, they can then make the diagnosis that it is actually ringworm. So how do we treat or prevent ringworm? Ringworm is usually treated with antifungal creams, powders, or gels. Powders tend to be used for like Tinea pedis, for like athlete's foot, but creams and gels tend to be used for like the other smooth areas of your skin. Two commonly used creams are clotrimazole and miconazole. Non-severe cases of tinea are usually cured within like 1 to 3 weeks, but more severe cases are usually treated within 1 to 3 months with the use of oral medication. So how do we prevent ringworm? To prevent ringworm, as we can see on this photo, it says that you should regularly bathe, regularly wash your clothes, limit like touching pets and animals that are unhygienic. Make sure to clean your pets and animals often as well, so it lessens the risk of infection to other animals or other people. And just not sharing personal products with other people, just being careful and hygienic is the best way to prevent getting ringworm.
So we're going to talk about the microbiology connection to our personal lab. So similar to the gram stain we did, the potassium hydroxide test, or the KOH test, tests for gram negative and gram positive in the organism. So then, for special cases such as Tinea capitis, which is ringworm in the scalp, head, hair shaft, brows, or lashes, we use a special light called a Woods light, which is a UV light, which helps see the organism inside the hair shaft, since we can't see that by just simple examination. The virulence factors that help the organism spread and adhere are proteases, keratinases, lipases, and phospholipases. These what help to break down the skin and make it easier for the organism to stay present on the skin. As for the cell morphology, we can see that this one is testing gram positive, and we see a bunch of different cocci. And this specific slide comes from Tinea dermatophytes. I don't know if you can see that.
For human connection, I picked a real person experience. A young traveler traveling overseas started developing ringworm during her overseas trip. She noticed like a little small bumps on her body, but she missed it, didn't think much of it. But after a few days, it started expanding and growing into big circles around her body and chest. She described the feeling as very uncomfortable and very embarrassing and frustrating to have. This also took this impacted her confidence, this impacted her emotional well-being and daily routines because of the ringworm. She also mentioned it as being very itchy and patchy also. As you can see, this is what it would look like on a person.
So thank you so much for listening, and we hope you learned about ringworm and how you can reduce